is the active vertebral artery test. And so basically what you want your instruct your patient to do is, if you're testing the right vertebral artery for sufficiency, you want to have them look over their shoulder to the right using their upper cervical. So you want to have them just do a really discrete movement. You can give them tactile cues at first. So I want you to kind of bend your head like this and kind of look over your shoulder, okay? And it's a side bend and rotation to the right. And what happens when you do that is that your left vertebral artery gets occluded, and so you're testing sufficiency of the right. And so when they do that, you ask them, you want to be talking to the patient, so you can have them like count backwards from 15. Go ahead and count backwards from 15.
14, 13, 12.
And you're looking for reactions like nystagmus, dilation of the pupils, slurring of speech, and stuff like that. Dizziness is not a symptom. And then you want to keep going segmentally, yeah. So you want to have them keep bending your neck now. You can use your lower neck, or your lower part of your neck a little bit more to look more over your shoulder this way. Okay. And then you want to see if they're producing any symptoms. And the lower you go, the upper cervical is always going to be occluded on the left, but the lower you go, looking over your shoulder to the right, you could possibly occlude it on this side if you have any insufficiency on this side in the lower cervical. And so he could start producing symptoms like further on in the assessment. And so you want to keep talking to the patient and have him keep moving little by little. Go ahead.
But you want to hold each segment for 15 seconds?
Yeah, hold each time for about 15 seconds. An example of what could be wrong in the lower cervical, an arthrosis of the uncovertebral joints, or a mass on one of the joints, or joint space closing onto the artery. Okay. And then the next one we're going to do is in supine.